executive order from President Trump to protect children from chemical and surgical mutilation. I signed a declaration: sex-rejecting procedures are neither safe nor effective treatment for children with gender dysphoria. These procedures fail to meet professionally recognized standards of care. Medical professionals or entities providing sex-rejecting procedures to children are out of compliance with these standards of health care. This declaration is a clear directive to providers to follow the science and the overwhelming body of evidence that these procedures hurt, not help, children. CMS is proposing 2 new rules. The first rule will bar hospitals that participate in Medicare and Medicaid from performing these dangerous and harmful procedures. The second rule prohibits the federal Medicaid dollars from funding the sex-rejecting procedures on minors. The FDA is issuing warning letters to 12 manufacturers of breast binders. The FDA is telling these companies that the illegal marketing of breast binders to children for the purpose of treating gender dysphoria commits significant regulatory violations and requires swift congressional or corrective action. If the manufacturers don't comply, they could face enforcement actions, including product seizures. HHS is also moving to reverse the Biden administration's attempt to include gender dysphoria within the definition of disability. My uncle Ted Kennedy was the primary author of the Americans with Disabilities Act and of the 1978 amendments that strengthened the Rehabilitation Act. The Biden-era amendments that designated gender dysphoria as a disability served the commercial interest of a predatory multi-billion-dollar industry that betrayed the original intention of those laws and gendered widespread public resentments against those laws among the American people and discredited the statutes in the public mind. Our proposed rule will reassure recipients of HHS funding that policies preventing or limiting sex-rejecting procedures do not violate disability non-discrimination requirements. Assistant Secretary of Health Admiral Brian Christine today signed a public health message to inform healthcare providers, families, and policymakers that current evidence does not support claims that puberty blockers, cross-sex hormones, and surgeries are safe and effective treatments for pediatric gender dysphoria. President Trump has made child protection a national priority. The Make Our Children Healthy Again strategy demonstrates that commitment. Sex-rejecting procedures rob children of their futures.